हेलो गुड मॉर्निंग। ऐसे डॉक्टर आर्यन और आज हम डिस्कस करेंगे मेडिसिन के पास्ट ईयर क्वेश्चन पेपर। विच इज द बेस्ट कंफर्मेटरी मेथड टू इंश्योर द सेंट्रल लाइन इन द जुगुलर वेन? Chest X-ray is the best answer because the X-ray is the chest confirmatory method to ensure the central line in the jugular vein. Next question: what is the purpose of using the modified Duke criteria in diagnosis? In diagnosis, here the best answer is the infective endocarditis because the modified Duke criteria are widely used criteria for diagnosis the infective endocarditis, which is an infection of the where endocardium of the inner lining of the heart, including heart walls. The criteria have to stabilize a diagnosis based on clinical laboratory and echocardiography finding, and they take into the account major or minor criteria as well as the presence of predisposing factor to classify the likelihood or of infective endocarditis. Next question: which medication uh, could be the cause of recurrent falls in the early male patient? Prazosin, metformin, acarbose, and thiazide. The best answer is the prazosin because the prazosin is an alpha 1 blocker medication used primarily for the treatment of hypertension or benign prostate hyperplasia. Benign prostate hyperplasia. However, one of the common side effects of prazosin is orthostatic hypotension, which can increase the risk of falls, especially in the elderly patient. Orthostatic hypotension refers to a sudden drop in blood pressure upon standing. Sudden drop of blood pressure when a patient is sudden standing, leading to dizziness or lightheadedness and can result in falls. Next question: a person with dyspnea has a likely limitation in physical activity and doing ordinary activity causes symptoms, but he is asymptomatic at rest. To which class does he belong based on the New York Heart Association functional classification? Class 1st, class 2, class 3 and class 4. The best answer is the class 2 because as the patient has dyspnea or light physical activity, there is a slight limitation of physical activity. He is asymptomatic at rest. This is a class 2 NYHA classification. HA classification. Next question: what is the probable diagnosis for a 55-year-old male patient who came to the hospital complaining of palpitation during examination? A diastolic murmur is detected in the left third intercostal space, along with the presence of pistol sound over the femoral arteries in the aortic regurgitation. Because we discussed the above patient here presents what diastolic murmur and a pistol shot over femoral arteries, which is such to of aortic regurgitation. There is a backflow of blood where the aorta and to the ventricles at the time of diastole. Next question: which of the following statement about the culture taken in a suspected case of infected endocarditis is correct? 2 samples from peripheral lines 30 minutes apart, the 3 samples from peripheral lines 1 hour apart. This is the correct answer because the blood culture in a patient suspected of infective endocarditis who has not received antibiotics during the prior of 2 weeks. 2 bottles blood culture set containing the appropriate volume of blood 10 ml per bottle should be obtained from different venipuncture site. After that, venipuncture site 1 to 2 hours. If the culture remains negative after culture negative है after में 48 to 72 hours, 2 or 3 additional blood culture sets should be obtained and the laboratory should be consulted for advice regarding optimal culture techniques. That's all. Thank you and keep revising.